Hello, my name is Kelly Martinez. I'm a gynecologist here at the Women's Center of Denton. My focus is gynecology, where I look and work with the reproductive system in women. The disease I find myself working with a lot is endometriosis. Endometriosis happens to be where the lining of the uterus grows on the outside instead of the inside. The disease is really common in women between the ages of 15 and 45, though I see myself working with patients between the ages of 17 and late 20s. I have worked with this disease 50 times in about 100 patients. Like I mentioned before, my age group tends to be 17 and late 20s. There are signs that could potentially lead to endometriosis that women have. Some of those being irregular menstrual periods, problems with the flow during the menstrual period, genetics where someone in their family went through endometriosis, and most commonly known is pain. Pain is known to be the most common symptom for endometriosis. The pain varies based on the women. Some have very bad menstrual cramps. Some have very bad pain in their lower back and their pelvic area. Some even have pain during and after sex. There's painful bowel movements. Again, some women don't even experience some of these pains, but some experience a lot of pain. Most commonly, though, it is like very strong menstrual cramps. Another symptom of endometriosis is infertility. Infertility, which happens to where you're not able to get pregnant. Some that is usually the sign of having endometriosis, and some develop infertility during endometriosis. There is ways to be diagnosed with endometriosis. There's pelvic exams and different types of exams, but the most commonly known to be officially diagnosed is the laparoscopic surgery. The surgery is the official way to be confirmed that you have endometriosis, and this is where the doctor can physically go into your pelvic area, look at the endometriosis tissue, and they're able to see if the tissue obviously is growing on the outside of your uterus, then that's endometriosis. But that's the most common way to confirm endometriosis. Worst comes to worst, though, there is treatment plans. There's treatment plans being like on birth control. You can do the laparoscopic surgery, which what they do is they'll go in and they'll burn that tissue on the outside of your uterus. That usually helps with pain too. Obviously, they don't recommend that surgery numerous times though, due to permanent scar tissue that can get built up. There's also medicine. You can do birth control pills. You can do shots. And worst comes to worst, to officially get rid of endometriosis pain and all that, is to remove the uterus by a hysterectomy procedure. That's that's like the last resort, due to meaning if you remove your uterus, obviously you can't have children. The one patient I do have in my office that I see regularly is a 21-year-old Hispanic female. Patient comes from a middle socioeconomic class. She's still in college, lives with her parents. She's been coming into my office since she was 17 years old, which is when she was diagnosed with endometriosis. Patient has no other medical past histories other than celiac disease. This is before she came to me. She went to a gastroenterologist, which is where she was diagnosed with celiac. But she still had numerous pain. So her doctor ended up referring her to me, her gynecologist, where I then went in laparoscopically and confirmed her endometriosis. After that, she went on birth control shots throughout for 6 months, in a duration of 6 months. She then had another surgery. She's had 3 surgeries already, and after that, I've decided not to perform any more surgeries for a couple of years due to permanent scar tissue that was already getting built up. So now the patient is still on birth control shots. She takes birth control shots every 3 months. And if the pain gets worse, I have prescribed her pain medicine. As a doctor who works with numerous patients with endometriosis, I have noticed that the outside community has no clue what the disease is. Endometriosis is such a common disease, but there's no education on it. As a doctor, I recommend people know about endometriosis, and I feel like they need to know what it is, what the effects can be from it, and ways that we can help it. And I feel like a lot of people don't know that they can develop other diseases with endometriosis, like ovarian cancer and breast cancer can be developed. A lot of health professionals don't look at the bigger picture in ways that, maybe this medicine or this treatment plan isn't working for this patient, so I need to see why it's not working and see if there's anything else developing, and then work on after that. And so I think the best option is to know your patient and know what works with them and what doesn't work with them, and know that doing surgery after surgery, doing too many surgeries can develop really bad permanent scar tissue, in which once scar tissue is built up like that, there's nothing that we can do. That there also is no cure for it. Though you can do a hysterectomy, there's no official cure for it, and there's no official reason why you're diagnosed with it. So I feel like that's a major problem that needs to be solved still, is what else we can do without removing the uterus. Another issue is why suddenly young women are getting diagnosed. Like I mentioned before, I work with women who are between the ages of 17 and late 20s. So I feel like there needs to be a reason why all these young women are getting diagnosed with it. But other than that, endometriosis is affecting women of all ages, and it needs to be fixed and cured and, helped. Thank you.